State Rep Carol Glanville. I represent the 84th District, which is Walker, Granville, the northwest side of Grand Rapids. I've always been interested in public service. As a former school teacher, I was always engaged in a lot of community action through that work. And so this is just kind of a logical next step in the work that I'm doing. And I'm still here to really advocate for schools and kids and teachers.
Hi, I'm State Representative and Dr. Matt Longjohn, representing the 40th District in the House of Representatives. That's a good chunk of Kalamazoo County. The city of Portage, Oshtemo Township, and Texas Township are the municipalities in my district. And like Carol, I'm here kind of continuing a life journey. I'm the only physician in the House or the Senate. My career has been in improving health systems, and I hope to do that work in the legislature if they let us. Rep. Glanville and I are sitting on the north steps of the Capitol today on, I guess, what will be the second time that we will have spent hours debating whether we're going to, I guess, as Michiganders, rename the Gulf of Mexico 1,000 miles away. I know I'm frustrated. I know Rep. Glanville's frustrated. We want to get to working on things that we know Michiganders care about, and I find it hard to believe anybody's losing sleep over the name of a body of water 1,000 miles away. But there's probably other better things going on this week.
I think there are.
What's on your agenda?
Well, it's Teacher Appreciation Week. I don't know if you were aware of that. So, what's always on my agenda is schools, teachers, the work that we're doing there. And so I know recently I was at a convening at my local city chamber, and one of the things that came up was the idea of class sizes and if that has any real impact on education. And my colleagues from the other side of the aisle seemed to think that it was a little bit of fluff. And so I explained to them how an appropriate student-teacher ratio fixes so many things. Like you can get, that better relationship with the kids. You can really dig in and help them when they're having trouble. You know what it is that's bothering them and what their style is, and you can teach to them in a much more effective way. We know that absenteeism is a problem in our schools. And again, if you had a class that was like 1 to 20, you would really be able to work with them and the kids would want to then come to school. You could do interesting things. The way that we have our classes loaded up now, there's no opportunity. And so I think, having an educator mindset like you have your physician mindset really helps us to see those, what might seem like a really small or maybe inconsequential issue, how much it can really, that ripple effect throughout the whole system in just one small change and making that a goal, how much that could really impact the quality of education, not only for our students, but for our teachers as well.
I love that you're always lifting up teachers and schools. My mom was a teacher. My aunt was a teacher. I pretend to be a teacher when I instruct courses at the med school. But frontline workers, in schools, need all the help we can give them. And
yeah.
So does Teacher Appreciation Week, in your experience, give people a shot in the arm, or is there ways you're communicating about it?
There are. I mean, we always talk about them. There's often things you see on social media where people recount like how long they've been a teacher and how many kids they've impacted over the years and things like that. And so that's great. A lot of times parents really, pick up and do any little small thing. So there's little gift cards or just a card of appreciation. I remember a Teacher Appreciation Day one time where a student of mine had an interest in photography, and so she had done some taking of photos and brought one in for me that she really had spent some time on, and that was my Teacher Appreciation gift. And it's those little things as a teacher that just I don't need anything else, just give me that that photo, it's perfect. And I imagine in healthcare you get a lot of that kind of just small token thank you that is more valuable than anything else.
Nonverbal stuff even, right? Just like sometimes the look in somebody's eyes where you've helped them or something, But I'm remembering back as you're speaking to all the teachers in my life, not just my mom and my aunt, right? But people who affected my life. My wife and I met in first grade, so one teacher in particular is coming to mind. But it's an important topic. What else is on the agenda in schools right now? What are you seeing in cuts?
Well, yeah, I mean, I'm very concerned about the budget that the House Republicans passed, what was it, a couple weeks ago, a month ago or so now, 6 weeks maybe. where they took out 25% of our school budget. We lost meals, were cuts to transportation. I mean, really just cuts everywhere. And so, I know they have said that this is just a backup budget just in case. Unfortunately, the amount of money that's in that budget would not serve as a backup either.
I'm not buying it.
No, I mean, it's quite performative. It's a good piece of political theater. I'm not sure what the, goal is there, what they hope to gain from it, but yeah, it's not near enough. Like I said, even for an emergency, let's keep things going type of budget. So it concerns me. We hear so much about the importance of good quality education, and we often hear people denigrating teachers in schools. They're not doing their job. But then we get stuff like this. It's like, well, how are teachers in schools supposed to do their job if they don't even know what their budget is? Right. And it just burns me every time that we put our kids in this position where they can't vote. They're like the ultimate, I don't have a voice in government. And so they just use them as a pawn all the time. And I just can't even comprehend it. It just, as you can tell. No, I just like, pick on somebody else. They can't come to the state and advocate. I mean, some of them do, right? We sometimes see kids in the classroom, or they're here on their little tours and stuff, but yeah, they have no idea what's going on, and it's the adults, in the classrooms who are left having to manage that and pull another trick out of the hat and hope the kids, assume everything's just normal. Yeah. We don't want to, create more trauma and, just insecurity in our schools. They've been through enough with the, the gun violence and with COVID, and, we always try to protect them and to help them deal with things. And this is just a manufactured chaos, a manufactured problem that doesn't need to exist.
I'm a newbie, right? Was only elected in November, first termer, and people ask me all the time, like, what surprises you? This afternoon on the Capitol lawn, someone from the Area Agency on Aging that I saw said, what surprises you most? How's it going? And I said, I have a hard time because I'm an impatient person. I don't like it when I feel like my time is being wasted. Yeah. And with these important issues, right, in schools and in healthcare, people's pocketbook issues, it's so exasperating to see the level of theatrics that are being injected into our budget and into our politics. Those frontline folks you were talking about, the teachers, are also on my mind in healthcare. Today, this week is also Nurses Appreciation Week.
Yeah. Well, my mom was a nurse.
See,
my son is in med school. My other son's girlfriend is a nurse. My niece is a nurse. Another niece is so yeah. I got a lot of healthcare in my family.
Here's to the nurses. It's an important week to recognize nurses as well. And a lot like teachers, right? The front line of our healthcare system. And nurses have so many responsibilities and often are in those thankless tasks, those jobs where so much is expected and to whom so little is given in terms of respect. So I know we're on the same page in supporting teachers and nurses. Kind of, again, equivalent to the conversation in schools. Nurses have a bunch of issues right now that are up, and I wish we weren't talking about the Gulf of Mexico and we're actually thinking about what our healthcare system needs. The ratios of nurses to patients gets in the way of quality care. People who are serving other people as nurses, if they're expected to see and take care of every need in a hospital ward of too many patients at a time, can't give adequate quick care to the folks that need them the most at that moment. It's kind of equivalent to classroom sizes.
It feels that way. Well, and tell me about overhead, because I know one of the issues too for our schools is there is so much administrative work, so much paperwork, so much reporting. And yes, we want accountability. We want to know what's going on and that kind of stuff. But I feel like we just don't trust our professionals enough. We constantly are asking them to prove that they're doing their jobs. Yep. And again, that gets in the way. I mean, teachers are expected to be, in front of students 7 to 8 hours a day. And yet they're also expected to do all of this paperwork. And I know from my mom, like having grown up with a nurse, the charting I imagine there's another similar issue there. Is that true, or
Oh,
is
it's a
that?
huge burden on lots of
Mm-hmm.
folks. Kind of a necessary evil in some
Mm-hmm.
ways, right?
Mm-hmm.
To be able to document what you've done and not done is important for generating revenue in a
Mm-hmm.
claims-based, you know,
Sure.
uh, volume-driven healthcare world, where you have to see so many
Mm-hmm.
patients or take care of so many patients at a time. Documenting all of that is kind of the 15-minute increment things
Mm-hmm.
that drive billing and coding and ultimately keep the system afloat. But on top of those kinds of requirements, for nurses, there's things like mandatory overtime,
Mm-hmm. Yep.
and a lack of things like lifting limits that lead nurses to have occupational risks,
Mm-hmm.
back injuries, things like that. We just aren't taking care of our healthcare workforce. And if we want a better healthcare system, we've got to have a strong healthcare workforce.
Mm-hmm.
There's a bunch of policies, again, that I wish we could get to
Yep.
here.
Mm-hmm.
But all of this is in the context of incredibly troubling, terrifying cuts
Yeah.
to education, to Medicaid that will impact all of these professions and the
Mm-hmm.
pocketbooks and daily lives of every Michigander.
Yeah. Well, and when we talk about Medicaid, I think many people don't realize how much that Medicaid standard impacts everything. So we base some of our at-risk dollars and some of our special ed dollars on Medicaid.
Absolutely.
We base in education, meals are predicated on
Yeah.
Medicaid, and so it's not just a healthcare cost, right? And we know the vast majority of people in the state of Michigan are women and children that use Medicaid.
Yes.
And that number is so much more important, like I said, than I think a lot of people realize, and how it touches so many different funding streams. And yeah, to have that hanging in the balance, or to have unpaid bills. I know we're trying to square our books on Medicaid right now and having some challenges just agreeing to meet our bills, to pay our responsibility,
contractual
yeah, our response,
obligations.
exactly. And instead, again, we are just somehow litigating federal policy here at the state, and it concerns me that our colleagues are so far out of their lane. Like, we are not federal legislators. And while I appreciate that we, to a certain extent, work in, it's a vertical, and we work, in that team, but we have state issues that we should be
100%.
addressing. And to your point, they're not getting addressed.
Yeah.
And they could be. And we all have legislation. I mean, there's thousands of bills ready to go. And, instead, we're just relitigating whatever's happening at the federal level and not taking care of Michiganders. And it's really concerning.
And not even being able to plan and work on the policies that
Mm-hmm.
could be our stopgap
Yep.
from all these cuts. I completely agree with you that Medicaid is a poorly understood but essential program.
Absolutely.
It is. I was yesterday describing it as a card at the bottom row of a house of cards,
Mm-hmm.
and if you pull that like a
Yeah.
Jenga block or etc., our whole healthcare system can tumble.
Yeah.
And you made excellent points because Medicaid is at the base and connected to so many other
Uh-huh.
things that 2.7 million Michiganders depend on. A million children in Michigan depend on Medicaid. 45% of all live births in the state of Michigan every year are covered by Medicaid. Moms and kids, and also older adults. 65% of long-term care is paid for by Medicaid.
And here we are in Older Michiganians Day.
It is Older Michiganians Day.
Yeah.
I was saying that the area agency on aging folks who we were talking to earlier, who said, "What are you doing in there?"
Yeah. Well, and I had another conversation in my office today. We have a private ambulance service in the Grand Rapids area where, again, because the Medicaid reimbursement rate is so low, it's critically low, and it hasn't been lifted. It's not set where it needs to be set.
Yeah.
And again, that's another service that many people don't realize. It's actually a private service. They think ambulance, they think public for some reason, right? Those aren't tax dollars that pay for that service, and yet they cannot turn anybody down. Similar to an emergency room, like they get the call, they go,
Yeah.
and they're not getting paid for the work that they're doing, even at like a base Medicaid level.
Correct.
So again, it's just very concerning, from long-term care to school meals to basic health care to ambulance service. There are so many things that Medicaid touches, and we all need to be concerned about that, because if that's gone, it will impact all of us, whether we are Medicaid recipients or not, because our friends, our neighbors, our family will be impacted.
Yeah, the two examples you already raised. One, contractually, Michigan hired Medicaid
Yes.
managed care organizations to take care of the business of Medicaid on our behalf. And they got stuck with a $55 million bill at the end of the last fiscal year. And if we don't live up to our contractual obligations, which could be fixed through very simple legislation, I mean, it's not rocket science or medicine or even as complicated as teaching.
No.
We just need to pay our bills, and yet that's not what's happening.
Well, and the thing that gets me too, it's not, there wasn't like an error, right?
No.
We have to adjust, and I think anybody can understand this. You budget a certain amount of money, and then it either ends up costing a little bit more, a little bit less. Like if you're building a house, right? You come in, and so you might have to come up with some extra money. We can't get that number right when we think about Medicaid or Medicare, right, in the healthcare space, because maybe more people get sick this year, or maybe they don't, or we have an aging population. So there are just all these factors, right?
The projections for the 2024 Medicaid bills that the insurers have been stuck with, those projections were made in the last months of COVID.
Yes.
There was so much uncertainty.
Yeah.
So, we need the system to remain intact, or else rural health centers will close. Federally qualified health centers will close. Our safety net will just fall apart.
And we have the money on the books. Like, this is a normal part of the budget process. This money didn't just like appear from somewhere, right? It, like you said, it was medical services that were provided to the people of the state of Michigan, and we just need to balance out that bill. So, I wish I could tell my healthcare system, oh, sorry, you told me it was going to be X. So, it's just, that's what gets me, is I feel like oftentimes too, there are many people who maybe just don't even understand the process who are making the decisions. And that, again, is a frustration. Like I said, when they're choosing to focus on, unimportant to Michigan issues, such as renaming the Gulf of Mexico, and then not treating some of these really serious top-line issues that are just regular procedure for us.
We're not doing the work of Michiganders.
No, it's unfortunate.
But
some of us are.
Yeah, we're trying, showing up for work anyway. But I so appreciate what you said, and as a newbie, I gotta say you're a great teacher, helping to bring me along in the steep learning curve that I've had as a first-term legislator. I wish all our conversations in the building behind me were as serious as this one. Thanks for joining me in the conversation.
Well, and thank you, because I am learning so much about that whole healthcare and physician aspect of things. And again, that's another area that touches many different issues, and how that, I love the perspective that you bring when we're talking about something seemingly unrelated, and then you can point out, but wait a minute, this could have a ripple effect. And so, just, it again highlights how complex these decisions are, and how important it is to have somebody in there as a voice. And so I appreciate that you are representing all of the physicians of the state of Michigan here in our body.
Thank you.
So thank you. You're doing a great job, and it's a pleasure, and I'm proud to serve with you.
You ready to get back to work?
Sure.
All right, let's do it.
Okay.